Okay, good afternoon everyone. Ma'am Mildred.
Afternoon po. Pagpapatuloy po natin ang ating pag-aaral, pagre-review sa ating topic po, ang Jing Essence. Number 2 na po ito. So, yung 3 types of essence po, ito yung pre-heaven essence, post-heaven essence, and kidney essence. So, pre-heaven essence, conception is a blending of sexual energies of man and woman to form pre-heaven essence. Ito po yung prenatal essence of newly conceived human being. Pre-heaven essence nourishes embryo and fetus during pregnancy, dependent on nourishment derived from mother's kidney. Only kind of essence present in fetus, as it does not have independent physiological activity, determine its person basic constitutional makeup, strength, and vitality. It is what makes its individual unique, closely linked to fire of gate of life, Ming Men. So yun po yung free heaven essence, yung namamana natin mula sa mga magulang. Fire of gate of life. So ito po ay situated between kidneys. Physiological fire of body, which provides warmth essential for all body's physiological processes and for all internal organs, already present from birth and from conception. Present from conception and birth, but it then matures into kidney essence at puberty, when it generates menstrual blood and ova in women and sperm in men. So ito po yung ating drawing. Fire of gate of life. So accumulates at point 24 Ming Men on spine at conception. Pre-heaven essence concentrate at point Ren 4 Guan Yuan, also at conception. So ito po yung napaka-powerful po nitong Ren 4 na to, kasi pag acupuncture po natin ito or pinressure, nagre-release po siya ng yuan chi. Ibig sabihin yung chi na nandito sa ating kidney ay nire-release po niya at tinotonify din po yan. So, yan yung connection po So, ito yung motive force nandun po sa kidney nakalagay. Fire of gate of life correlates with uterus.
Pasensya na kasi data lang yung gamit ko eh. Wala kaming ilaw. Grabe. Brown.
Ano kaya, Doc, ako mag-share screen?
Sige
Pwede
po.
Pwede po pa yun.
Nasaan na ba tayo nag-start? Okay, ma'am.
Ayan po. So, fire of gate of life correlates with uterus, where menstrual blood is stored in women, and with room of sperm in men. So, residence of mind and essence. Connected to original chi, ito po yung yuan chi. In men, it houses sperm. In women, the uterus. So, nasa yuan chi po yun. Po. Ay, paano ako mag-share screen? Pre-heaven essence. So, since naman na po natin ito sa mga magulang, ang pre-heaven essence ay influence only with difficulty in course of adult life. Some say this is fixed in quality and quantity due to its interaction with post-heaven essence. Kumbaga, kung ano yung nakalagay sa ating kidney, yun lang yung haba ng energy. So doon din nakadepende yung haba ng ating buhay. Parang ganon. It can be positively affected even if not quantitative increase. Timpa natin. So, yung parang explanation po no na, yun nga, kung ang yuan qi natin o yung kidney essence na yun na nakatago sa kidney, kung lagi nating magagamit at hindi nare-replenish kasi yun sa pamamagitan ng post heaven natin essence yung mga kinakain. So kung hindi nare-replenish yun at lagi nating ginagamit, halimbawa yun nga, kung laging may sexual intercourse na nagagamit ng lalaki yung sperm, laging nanganganak ang babae, ikli po yung energy ko, konti yung energy. So depende dun yung haba din ng ating buhay. Okay po, maraming salamat.
Thank you very much, Ma'am Mildred. So if there are no questions, we will proceed to tongue diagnosis. And let's welcome Ma'am Teresita Sumile. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa tongue diagnosis. Now let us talk about tongue body shape. Tapos na po tayo sa tongue body color at ngayon pag-aaralan naman natin ang tongue body shape. In tongue diagnosis, una-una nating tingnan ay ang tongue body color. Next po ay ang tongue body shape to determine the condition whether it is deficiency or excess. Okay? Next slide, please. Observation of the tongue body shape reveals primarily conditions of deficiency or excess. It also adds information that gleaned from deficiency of the tongue body color. Observation of the tongue body shape reveals primarily conditions of deficiency or excess. It also adds information to that gleaned from observation of the tongue body color. For example, a pale tongue may indicate young deficiency. However, if in addition to being pale, the tongue is also very swollen, this indicates that the young deficiency is severe and that it has led to the accumulation of dampness or phlegm. In this example, the tongue body shape reflects the full condition generated by dampness or phlegm. Okay? To give another example, if a tongue lacks coating, it indicates yin deficiency. However, if in addition to its thin, this indicates that the yang deficiency is quite severe. In this example, the tongue body shape reflects the severity of a deficiency condition. To give yet another example, if the tip of the tongue is red, it indicates heart heat or heart fire, usually deriving from emotional problems. However, if the tip is also swollen, it indicates that a condition of heart heat or heart fire is more severe. So let us now integrate the tongue body color to its body shape. For example, our patient has a pale tongue. Nasa isip na natin na ang pasyente ay may yang deficiency. Then let's take a look to its body shape. If it is swollen, then it will be a severe yang deficiency, which reflects a full condition generated by dampness or phlegm. Another example, if the tongue lacks coating and the tongue body color is normal, it indicates yin deficiency. And if the tongue body shape is also thin, it indicates a severe yin deficiency, and this reflects a deficiency condition. So, tongue body shape primarily reveals the conditions of deficiency or excess. Okay? Now let's go to thin tongue body shape. Thin refers to the thickness, not the width of the tongue. The body of the tongue is formed by fluids and blood. Therefore, a thin tongue always indicates a deficiency either of blood or yin fluids. In the former case, it will also be pale, whereas in the latter case, it will be red. So if the tongue body shape is thin and the tongue body color is pale, it indicates blood deficiency. However, if the tongue body shape is thin and the tongue body color is red, it indicates yin deficiency. Okay? Next slide, please. Now let's go to swollen tongue body shape. Meron pa pala, sorry po. A thin tongue is actually not common, probably because dampness and phlegm, which make the tongue swollen, are such common and predominant pathogenic factors. Because they tend to make the tongue swollen, even if the patient has a concurrent severe blood or yin deficiency, it would not manifest in the tongue body shape. According to the author, in my practice, for example, of 2,378 patients, fewer than 2% have a thin tongue, whereas nearly 37% have a swollen tongue. Excuse me po. Now let's go to swollen tongue body shape. Okay na, Doc?
Yes, please.
So now let's go to swollen tongue body shape. The size of the tongue body has to be related to the size of the head of the person. What might be swollen for someone may not be normal for another. Because the thickness of the tongue body depends on the supply of fluids and blood, a swollen tongue body indicates an accumulation of fluids, which may be dampness or phlegm or edema. Thus, swelling of the tongue always indicates a full condition, particularly characterized by dampness or phlegm, although dampness and phlegm usually arise from a qi or yang deficiency. The swelling of the tongue body reflects the full condition created by these two pathogenic factors. So, ito ay ang itsura ng swollen tongue body. Okay? Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We will now proceed to diagnosis by interrogation. And let's welcome once again Ma'am Vina Pasqua from Baguio.
Yes, good afternoon po, Doctor. Good afternoon po sa lahat. So day 13 na po tayo at feeling of cold, acute fever po. So alam na po natin, pag sinabi nating acute, sudden onset po. So acute internal fevers usually nagde-develop po from the acute stage of an invasion of external wind. Both wind cold and wind heat. At ito ay naglilid po ng internal fever. Thus, the fever discussed here is primarily an acute fever deriving from external causes po, but at the interior stage na. So, in such acute fevers, yung identification of patterns according to the 4 labels po provides the best framework of interpretation. Kasi alam na po natin itong diagnostic framework na ginagamit ng mga practitioners para ma-identify ng patterns of imbalance or disharmony sa body at para ma-develop po yung treatment plan para ma-restore yung balance. So, however, there may be another acute internal fevers of internal origin. For example, from damp heat in the liver and gallbladder to yung febrile episode of cholecystitis. Pag sinabi nating cholecystitis po, ito yung swelling or inflammation of the gallbladder. Damp heat in the bladder, cystitis naman with fever. So cystitis, inflammation of the bladder pa rin, usually caused by bladder infection o kaya pwedeng UTI. So dito nakikita natin sa figure yung origin po ng acute fevers. From external cause of interior states, exterior fever po yan. And then acute fever from external cause of interior states at saka from internal cause to interior syndrome po, interior fever po yan. So yan po ang origin of acute fevers. So punta naman po tayo sa 4 levels. Sa 4 na levels na ito, yung defensive chi level is the only exterior. So nasa labas pa, and therefore, merong simultaneous fever po and shivering with a cold feeling. Sa 3 levels naman po, yung chi, nutritive chi, at saka blood. Heat is in the interior and the fever is interior. Yung identification patterns, according to the 4 levels, describe the symptomatology of invasion of wind heat. However po, yung fever, to a lesser degree, also may present in invasion of wind cold, for which the identification of patterns according to the 6 stages is used. Ito yung alam na po natin ito, yung Taiyang, Yangming, Xiaoyang, Taiyin, Xiaoyan, at saka Juyin. Yung 3 interior labels naman, yung chi, nutritive chi, and blood labels within the 4 labels represent 3 different, yung lalim po ng penetration ng heat. Yung chi being the most superficial, o kaya ay rather less deep, and blood, ito yung pinakamalalim na. At the chi level, the upright chi is akas pa rin and engaged in a fight. Lumalaban siya with the pathogenic factors, leading to a high fever and acute strong manifestation characterized by restlessness, high fever, profuse sweating, at saka iba pa. Pag sa nutritive chi naman at saka blood levels, the upright chi ay injured na. So, yung heat has injured the fluids at meron na pong yin deficiency. Itong levels na ito are usually characterized by a fever at night at saka yung mind po ay affected na. So, sanhi ito ng delirium. Severe, matindi o malala na po yung mental restlessness and in severe cases, coma na. At the blood level naman, internal wind can develop and bleeding occurs also at the blood level and to a lesser extent sa nutritive chi level. So meron na pong maculae. Importante po yung tongue and objective sign to differentiate the chi level from the nutritive chi level and the blood levels po at the chi level. The tongue is red and meron pong makapal na coating. Pag sa nutritive chi naman, ang blood levels, yung tongue, ang dila po ay dark red at wala na po siyang coating. So, yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina.
Ang halaga pala, Ma'am B, na makita talaga pag no coating, blood level na. So,
Opo, ma'am.
dapat matandaan po ano.
Actually, very
Opo. Sana
informative
po.
Hindi
talaga,
yung cheat.
no?
Opo.
At least natututo tayo ba? Hindi kasi masyado yan na pinapansin.
Opo, parang hindi po masyadong napapalalim din yan eh. So, mas
Oo.
ito, nahihimay-himay po natin.
So I think the best platform is really the Zoom. Okay, so punta na po tayo sa pulse diagnosis, and for today we will talk about the stomach and spleen pulse. Ito po yung right middle position. Okay. So imagine niyo yung pulse, no? Okay, sa taas ng stomach pulse, pag medyo may naramdaman kayo dyan, that tells a lot about the esophagus, yung proximal malapit na sa atin. So kung medyo malayo-layo, that's the duodenum. So malapit sa heart pulse. And then, if you move towards the right, it's the spleen or palalim, and then the lateral side, ang stomach. Okay? So, yung terms na external and internal, describing the different location of yang and yin organs on the pulse, there are three ways of interpretation. Okay, they can mean superficial and deep, lateral and medial, or distal and proximal. So in the case of right middle position, the most widely used interpretations are yung superficial and deep, saka yung lateral and medial. Okay. The most widely, so the stomach is felt on the surface or the lateral side, and then yung spleen naman sa deep level or the medial side. In the case of stomach and spleen, more than any other yin-yang organ systems, the relationship between the two is extremely close. So if you feel the right middle pulse, parang you take as a whole na yung spleen and stomach. So this is the state of the earth element. The differentiation between stomach and spleen should be seen not mechanically but dynamically, according to the clinical manifestations. As a rough rule of thumb, full type qualities on this position reflect a stomach pathology, whereas yung empty type ones reflect a spleen pathology. Okay? Meron na kaming kuryente. Okay. Now let's go to the floating. If floating yung pulse natin ng stomach, okay, let's stress a bit. Ita-transfer ko lang yung internet. So the differentiation between stomach and spleen should not be seen mechanically, but dynamically, according to clinical manifestations. No? Full type qualities or excess, no, will reflect a stomach pathology. Pag deficiency type or empty type, it's a spleen pathology. I think every one of us knows this now. So let's talk about floating pulse. A floating quality on this position is very common. So we're talking about the right middle pulse. And it always reflects a stomach pathology. So again, pag floating, tapos right middle, that's a stomach pathology. So it could be stomach heat or chi stagnation in the stomach. Okay? So when the stomach pulse is floating, the patient experiences pronounced feeling of distension in the epigastrium, kasi mga stomach, no? If the pulse is slightly floating but empty at the deep level, so empty, may stomach yin deficiency. This is also frequently seen in practice. So every time you feel the stomach pulse, pag yung superficial niya floating, of course, superficial naman talaga siya. And then when you apply pressure deeper, becomes empty, so that's stomach yin deficiency. Of course, you have to correlate this with the tongue. No? Next type of pulse is wiry. So kanina, we were talking about floating. Now let's go to wiry. So if you have wiry pulse, right middle, it indicates chi stagnation in the stomach. Okay? due to dietary irregularities, no? Katulad ng eating too much, eating in a hurry, eating under stress. Okay? If both middle positions, so right and left, are wiry, so that means may kinalaman na dito yung liver. Liver chi invading the stomach. So ibig sabihin galit siya parate and it's affecting the person, no? Nagkakaroon siya ng mga stomach issues.
Doc, meron nga pong yung kumakain na sobrang stress, parang nag-constrict po yung niya sa may ng chest. So nabulunan po muntik mamatay. Kaya yung kumakain talaga wag nagagalit. Talagang
Ay, oo,
lahat.
huwag ka na lang kumain kung galit ka. Okay? Weak pulse. So this is extremely common. So pag weak po yung middle, right middle, it means there is spleen deficiency. If the pulse feels very weak on the stomach position, but slightly wiry on the proximal side, so you roll your finger very slightly proximally, it may indicate a prolapse of the stomach. Ay, gawin ko pala yan bukas sa patient ko. Kasi sabi niya meron daw siyang prolapse sa stomach. O, diba? Stomach prolapse may cause considerable digestive problems even when it is minimal. So the pulse reflects this accurately. So meron siyang poor digestion, feels sleepy after eating, suffers a feeling of heaviness of the epigastrium, and is very very weak in general.
Tired.
Yeah, very tired in general. So if the pulse is weak, okay, relatively floating and hollow, it indicates stomach deficiency with slight chi stagnation. Okay, ito pala yun. Stomach acidity and pronounced epigastric distension. So weak pulse, floating hollow, kulang ng acid yung stomach, so hindi din natutunawan. So there is epigastric distension. If the pulse is weak and very slightly wiry, tapos yung lung pulse is weak, it may indicate stomach ulcer. O, humina na yung lung pulse. So parang lumayo na, no? From the stomach pulse sa lung pulse. If both right and left middle positions are weak, deep and slow, deficiency of stomach and spleen. Okay, thank you very much. That
Doc, pag may stomach, kanina yung topic mo, prolapse, may ipupus niya yung intestine, siya po ba yun yung buwa sa Tagalog? Yung parang lumalabas sa puwerta ng babae?
Oo, pero nasa stomach area to. Kaya feeling niyo
pwede
parang
natin gamitin,
mabigat. Oo.
Opo. Pwedeng gamitin ng do 20 para maibalik yung
Of course.
prolapse organ.
Yes, yes. Do 20. And of course, your spleen.
Opo.
Thank you very much po. That was very informative, I hope. Now let's go to Ma'am. I don't know if, okay, medyo ang internet yata ni Ma'am Needs. Let's now call on Ma'am Needs for differential diagnosis. Good afternoon, Ma'am Needs.
Good afternoon, Doc Hector. Good afternoon, everyone. How's my audio, Doc?
Very clear.
Okay
Thank
lang po,
you.
ma'am.
Thank you po. Welcome to RTCM Foundations, number 178, liver chi deficiency. Okay. So, etiology. It is the early emotional development of a person being bullied or over-criticized and not being encouraged enough can lead to the timidity and fear seen in this pattern. A diet lacking in blood-producing foods. Okay, yan isa sa mga cause. So, underlying and or accompanying pathology, gallbladder deficiency, deficiency of heart and gallbladder, liver blood deficiency. Okay? Sign and symptoms, dizziness, visual floaters, blurred vision, nervousness, timidity, tendency to be startled, madaling magulat, lack of courage and initiative, indecision, mahirap magdesisyon, sighing, depression, restless sleep, irritability, hypochondrial distension, and irregular periods. Okay? Ang pulse, pagka nagpalpit ka ng patient na to ay weak. Yung tongue, kapag tiningnan mo ay pale or normal. So, ang treatment principle, nourish liver blood, boost liver qi, supplement kidneys. Okay? Acupuncture treatments and points, liver 8 enriches liver yin and blood, stomach 36 supplements qi and nourishes the blood, REN4 or CV4 supplements the kidneys, GB40 gallbladder 40 supplements gallbladder qi, spleen 6 harmonizes the liver, and bladder 18 regulates liver qi and blood. Okay? Thank you very much. I hope you learn from here.
Of course. Meron palang liver qi deficiency, no?
Yeah.
Very rare. Kasi most of the is liver qi stagnation. Thank you very much, Ma'am Nitz. Let's now proceed
Yes.
to acupuncture patterns and practice. And let's listen to Ma'am Mildred. Good afternoon, Ma'am Mildred. She will
Magandang hapon pong muli.
continuation po ng depression. And I'm sure many would give a reaction here.
So, ito po yung mga acupuncture patterns po natin para sa acupuncture patterns practices depression number 2. Practice. Key points of analysis. The development of depression is principally due to blockades of liver qi, leading to the spleen losing its transportation and transformation function, and the heart losing its nourishment. So, nag-connect na po yung pag from the liver, punta po siya sa heart, siyang cycle siya then to spleen. Yun. Though all these three organs are generally involved in deciding treatment, it is important to ascertain whether there is stasis of blood, gelling of fire, accumulation of dampness or phlegm, or other condition of blockage or stagnation. Stasis of blood, stagnation of qi, and gelling of fire are mostly related to the liver. Food retention, dampness and phlegm accumulation are mostly related to the spleen. So sa spleen po siya pwesto. Deficiency, on the other hand, is most intimately related to heart. In diagnosis, a critical differentiation is between strength and deficiency. So yung lakas at saka yung kahinaan. However, strength and deficiency can transform into each other. For example, stagnation of liver qi and accumulation of phlegm are both illness of strength. So, excess condition po siya. In persistent illness, if they injure the heart and the spleen, they may lead to deficiency of qi and blood. And this in turn may develop into insufficiency of the heart and the spleen. If they injure the liver and the kidney, they may lead to depletion of yin essence. Yung papunta naman po siya sa co-cycle. And this in turn may develop into deficiency of liver and kidney yin. Among the deficiency, illnesses causing depression, the condition of stagnant qi, transforming into fire, often leads to yin injury by fire. Hence, production of blazing fire due to yin deficiency. Deficiency illnesses causing depression can involve from strength illnesses as well as from melancholic blooding. So from strength, dadalhin niya magiging weak, magiging qi deficient. Pent-up rage of other extreme passion damaging the visceral organs and consumption of their qi, blood, yin, and yang. In all illnesses of the later category, the symptom of deficiency are relatively prominent early in the course. Among the deficiency illnesses, that of mental derangement has its own unique symptoms and need not evolve from strength illnesses. It may result from pent-up anxiety or depletion of heart qi with insufficiency of nutritive level blood. Siyempre, kung nagkukulang na po yung nutrition, yung qi, maapektuhan. Kaya yung isi-circulate ng heart, makukunti din. Kaya kung konti ang qi ng heart, yun, magkakaroon ng either may lead to the heart losing its nourishment, which in turn give rise to mental derangement. Maapektuhan na yung puso. Pag naapektuhan na yung puso, yung pag-iisip, maapektuhan na rin po. In a patient with prolonged depression, there may also be mixed symptom of deficiency and strength. On the other hand, there is deficiency of genuine qi or depletion of qi and blood. So, pag matagal na ang depression, nadideplete na po yung qi at saka blood. On the other hand, there is depletion of yin essence, accompanied by stagnation of qi, stasis of blood, accumulation of phlegm, or gelling of fire. So, yun po yung effect ng sobrang tagal na depression. So, pag may ganun po, ang acupuncture treatment po natin tanggalin natin yung una, ito yung pag may stagnation of liver qi, select po yung liver 14. Tapos gallbladder 34, CV12, stomach 36, bladder 18. So, use filiform needles and apply the reducing method. Kasi excess condition is stagnation. Kaya kailangan nating i-reduce, reducing method po. Pag gelled phlegm and qi naman, select po natin yung CV12, stomach 40. Stomach 40 is special point to para po sa phlegm. And CV22, siyempre yung liver 3, use filiform needles and apply the reducing method din po. Kasi phlegm, excess condition din siya. Failure of heart nourishment. So, gamitin po natin yung pericardium 6. At heart 7, GB 26, bladder 15, vacuum of heart, and pericardium 5, and Shenmen by Tong Li, or yung heart 5. So, use filiform needles and apply reinforcing method. Dito naman po, reinforce kasi kailangan mong itonify. Pag mental derangement naman po, gamitin po natin ang pericardium 6, heart 7, small intestine 3, spleen 6. So, use filiform needles and apply the reinforcing method. Ito tonify natin. If mental derangement is accompanied by tics of the upper limbs, add large intestine 11 and large intestine 4. It is accompanied by tics of the lower limb, add gallbladder 34, bladder 60. So, if it is accompanied by rapid breathing and abdominal qi movement, CV17 po gamitin natin. Case study. The patient was a 46 years old woman. For more than 20 years, she had frequent sensation of obstruction by a foreign object in the throat. So parang may nakabara lagi sa kanyang lalamunan. May chest tightness, nausea, dysphagia. She received treatment on many occasions without benefit. Her pulse was small, deep, and slippery. So, ang diagnosis po ay depression dahil sa liver qi rising, abnormally and attacking the stomach and leading to gelling of phlegm and qi. So, yung therapeutic principle po, unblock the liver qi, settle the stomach, suppress the abnormality rise in qi, and dissipate phlegm. So, yun po yung gagawin natin. Sa case study 2 po, ang pasyente po ay married woman. For several months, nakakaramdam po siya ng palpitation sa parte ng puso, nahihilo, anxiety, tapos may periodic shaking. Meron pong headache at saka hindi siya makatulog, insomnia, at much dreaming when able to sleep. So, spontaneous sweating, may pakiramdam na pamimigat ng dibdib, and anorexia. Her faces tended to be dry and came only every 2 or several days. Her pieces tended to be dry and came only every 2 or several days. Hindi siya everyday nagdudumi. The shaking was sufficiently severe as the causer bed to creak. Ay ganun, talagang nagsishake yung katawan niya na pati yung kanyang higaan na gumagalaw. And sometimes, it came several times a day. Her tongue was pale and her pulse thread-like. So ang diagnosis po doon, depression of the visceral restlessness variety due to mental derangement. So ang therapeutic principle po, kailangan nating palakasin yung heart, nourish the heart, and tranquilize the mind. So thank you po.
Thank you very much, Ma'am Mildred. Next, we have signs and symptoms. Let's call again on Ma'am Teresita Sumile to do the honors. Topic niya, another interesting topic, grinding of the teeth. I don't know if some of you can relate here. Good afternoon po, Ma'am Teresita.
Good afternoon ulit, Dr. Hector and classmates. Signs and symptoms. And now let's talk about grinding of the teeth. Divergy invading the spleen. Signs and symptoms are grinding of the teeth when tense, irritability, abdominal distension and pain, alteration of constipation and diarrhea, stools sometimes dry and bitty, small pieces, and sometimes loose, flatulence, tiredness, tongue normal colored or slightly red in the sides, pulse is wiry on the left and weak on the right. Stomach and heart fire. Signs and symptoms are grinding of the teeth, bleeding gums, burning epigastric pain, intense thirst with a desire to drink cold liquids, mental restlessness, dry mouth, mouth ulcers, bleeding gums, dry stools, sour regurgitation, foul breath, nausea, vomiting soon after eating, a feeling of heat, sour regurgitation, palpitations, insomnia, dream disturbed sleep, feeling of heat, red face, bitter taste, tongue red with a thick, dry, dark yellow coating, and deep, full, rapid pulse. Retention of food. Signs and symptoms are grinding of the teeth in children, fullness, pain, and distension of the epigastrium that are relieved by vomiting, nausea, vomiting of sour fluids, foul breath, sour regurgitation, belching, insomnia, loose stools or constipation, poor appetite, thick tongue coating, and has full slippery pulse. Next is deficiency of Qi and blood. Signs and symptoms are grinding of the teeth, poor appetite, loose stools, weak voice, tiredness, blurred vision, dizziness, numbness or tingling of limbs, palpitations, dull pale complexion, pale tongue, and the pulse is weak or choppy. Next is internal empty wind. Signs and symptoms are grinding of the teeth, dizziness, headache, tics, fine tremors, tiredness, blurred vision, poor memory, fine and slightly wiry pulse. The tongue may be pale or red without coating, depending on whether there is an underlying blood or yin deficiency. Next, invasion of external wind. Signs and symptoms are grinding of the teeth, shivering, aversion to cold, fever, stiff neck, occipital headache, body aches, and has a floating pulse. Yan lang po. Thank you so much for listening.
Thank you very much.
Ma'am Tess, ay Doc, yung pag nag-grind yung teeth, pag natutulog, mas sa liver po siguro kasi halimbawa minsan, stress na natutulog, maririnig mo nag-grind yung teeth.
Pagod, stress.
Opo.
Yeah, that's true.
So,
yun
sa bata pala kasi yung apo ko dito, sometimes maririnig ko na mag-grind ng teeth habang natutulog. So, siguro food digestion.
Opo.
Stomach.
Alam natin, pag may grinding ng teeth, tingnan natin yung pattern kung anong organ.
Ang number one consideration, liver affecting
affecting the
stomach.
Opo.
Yes.
So yun ang ating tutusukan.
Yes. Maraming salamat, Ma'am Teresita. We learned a lot. Now,
Thank you din po.
Yeah, we're still on asthma. Walang katapusang asthma. Okay. We are going to continue the liver and asthma too. So another pattern would be liver fire insulting the lungs. So meron pong loud wheezing and asthma attacks elicited by emotional strain. So for the asthmatics, bawal po talaga sila ma-stress, no? Irritability, propensity to outbursts of anger, hypochondrial and chest fullness and distension. Okay, since liver fire siya, may bitter taste. And of course, thirst. Tongue is red, redder sides and yellow coating. Pulse is wiry and rapid. Treatment principle, syempre una-una, we have to clear the liver, drain the fire, subdue rebellious qi, no? Kasi hindi na bumababa yung qi ng lung qi. Restore the descending of lung qi, calm the mind. Okay. So points, liver 2, liver 14, which is the front view of the liver, bladder 18, back view of the liver, pericardium 6, lung 7. We use reducing or even method. Liver 2 is the main point to drain liver fire. Liver 14 and bladder 18 to clear liver heat and move liver qi. Pericardium 6 regulates the liver, opens the chest, eases breathing, calms the mind. And lung 7 will restore the descending of lung qi. These points are to be used in addition to those mentioned previously for the various patterns of asthma. Next, we have liver yin deficiency. So since this is liver yin deficiency, we always think of night. So infrequent asthma attacks at night. I'm sure we have seen patients whose asthma attacks occur only at night. Dry throat, dry cough. So there is also blurred vision, dry eyes, hypochondrial and chest distension. Pulse, okay, floating empty. Tongue red without coating. So treatment principle, nourish the liver yin, move the liver qi, restore the descending of lung qi, and calm the mind. So points, liver 8, Ren 4, spleen 6, kidney 3, pericardium 6, spleen 4. Reinforcing method kasi deficient. Liver 8 and Ren 4 will nourish the liver yin. Spleen 6 and kidney 3 nourish kidney yin, which helps to nourish liver yin. Remember, ang liver and kidney, they always have a mutual relationship. Nagtutulungan sila. Pericardium 6 and spleen 4 will open the yin wei mai or yin linking vessel, nourish the liver blood, open the chest, and calm the mind. So again, if you want to use this on women, you start with the right. Pericardium 6 ang right, spleen 4 ang left. Then sa mga lalaki naman, pericardium 6 on the left, spleen 4 sa right. These points are used in addition to the ones previously mentioned for deficiency of the lung and kidneys deficiency defensive chi systems. Thank you very much, CSL.
Doc, may share po akong ano dyan sa asthma. Kasi may
Sige
naging
po.
pasyente po kami noon na ikakasal po. So sobrang stress niya, inatake ng matinding asthma. So na hospital, kinaumagahan, kasal na, inoxygen ng doktor. So kailangan niya lumabas kasi kasal na nga po. Sabi ng doktor, sige palabasin kita, dala mo yung oxygen. Naisip nila, paano yan kinakasal, nakadikit yung oxygen. Mabuti na lang po. Nung dumating po yung kasama kong doktor din, may needle. So nung lumabas na po siya, inacupuncture namin. So yun natuloy yung kasal dahil may acupuncture needle.
Wow.
Hindi niya dinala yung oxygen.
O, diba? Congratulations. So, sana all, no? So, nakakatulong po talaga ang acupuncture. Yun
Opo.
nga lang,
Kasi
hindi pa natin na-educate ang mga tao. Kaya-
hindi siya maikasal dahil dala yung oxygen. Nung natusukan, lumakas. Tuloy ang kasal.
Kaya attend kayo sa PAI Convention on October 28, one day. Ang ating theme is acupuncture in the wellness, in the modern era of wellness. O, diba?
October 14?
October 28, last
Ayun,
Saturday of
natin.
October.
Sana makaluwas ka
Okay.
Manila. Face-to-face yan, Doc?
Pinag-iisipan pa, we will decide by May kung kaya ang hybrid. Yung ano, kasi
Opo.
parang, kasi mayroon tayong mga guests from Beijing. Pero sa totoo lang, we can make tipid if mag-webinar. Pero yung iba kasi sabik na. Titingnan daw muna kung dumami si variant.
Ay, oo nga po.
Oo, so yun ang ano. At saka you have kasi to reserve the venue ahead of time eh. So
Opo.
we cannot just reserve like 2 months, 1 month ahead. At least 6 months.
Okay naman po kung Zoom.
Oo, pero parang ano pa rin. Like,
Mas maganda pa rin po yung
meron po
face-to-face.
tayong i-invite ng Beijing group.
Para
we will
magkita-kita po
introduce,
tayo.
opo, Qigong, and other exciting modalities. 3 speakers in the morning, 3 speakers in the afternoon. Gagawin lang natin one day pero whole day. Okay?
Oh.
So maraming salamat po. And with that, we would like to thank everyone for joining and see you again tomorrow.